Going to hospital can be an extremely distressing experience, and people are often guarded about telling their deeply personal health stories. With Tasmania's health system under constant strain, we asked for your experiences and were stunned by how many of you shared your stories.
Mum sat in an ambulance for 3 hours, then she was seen for 5 minutes. She never went back
Arrived at 9 p.m. and walked out at 6 a.m. without even being seen.
I was shocked. Cannulas inserted in the waiting room and blood splatters on the floor.
Brilliant, but they're working under dreadful strain.
But for every criticism, there was a compliment.
You hear a lot of horror stories, but I was in and out.
Both the LGH and the Royal was just so thorough with their care.
ER staff are earth angels.
The people that make the system work are great.
Tina, can I just get you by saying... Tina went to the Royal Hobart Hospital after dislocating her shoulder.
The treadmill was out here in the living room, and then my 2 boys, they were playing on top, and then my 11-year-old asked me to make it go faster, but then I didn't realize that a 5-year-old was just beside him. I tried to save my 5-year-old, but then the treadmill got me.
Known for its long waits, she expected a long night in emergency.
Fortunately for us though, we didn't, because once we sat on the green chairs, it took maybe just 15-20 minutes before a doctor called us in. If I remember correctly, his name's Josh. He was so relaxed and very caring and gave the care that I think, would anyone in that kind of situation would need at that time.
Timing is crucial in an emergency. As well as preventing unnecessary pain and discomfort for patients, it can also affect their long-term recovery. In December, 54% of emergency department patients were seen inside clinically recommended timeframes. Timothy King went to the Mersey Community Hospital after cutting his finger at work.
She goes, yeah, wash it out. Then I said, X-ray. She goes, no, I don't need it. So she just washed it, steri-stripped it, and then just put a balloon over it. So about a week later, got up about 3 o'clock in the morning. It was just like a balloon, it was just puffed up, couldn't move it or nothing. So
scans showed there was still metal in the wound, with Timothy undergoing multiple procedures to treat the infections and reconstruct his finger.
We would sit up at nights on end, scared about what was going to happen with this finger, scared that it would, that he might lose his finger, that he would never get full movement back.
8 months on from the injury, Timothy's in pain every day, and his movement is still restricted.
As a partner, I see you some nights in so much pain and disappointment with your finger. You said, I just wish they'd cut it off.
The health department says assessments are based on the symptoms patients present with. Among the dozens of stories that came in was Ellie Boyd's. A day after her son was born at the Launceston General Hospital, there were signs he had a bowel obstruction.
They were onto things really quickly, and then they actually flew up a doctor from the Royal Hobart to see him, to the LGH, and that all happened within about 5 hours.
Then a doctor heard a heart murmur in Remy's chest. At just 5 days old, he underwent heart surgery in Melbourne.
If it wasn't for Hobart, most likely his heart, the valve that was affected, would have completely closed over and he would have passed away.
It's in those desperate times of need that Tasmanians turn to their hospitals. But not every experience is as positive, some falling well short of what you'd expect. The solution isn't simple. Bed block, poor morale and a broken primary health system are all weighing heavily. For its part, the health department says it's working to hire more doctors, nurses and paramedics. Adam Langenberg, ABC News.